Good morning, everybody. It's Intellectual Medicine. I'm Dr. Steve Petteruti here, along with Shannon. And joining us for his debut is Tyler, our producer behind the glass from University of Rhode Island. Welcome aboard, Tyler. Well, folks, today, as always, we are here to protect you from the harms of orthodox medicine. We have just coming through the cold and flu season, and we're going to be sharing with you a common treatment that is worthy of avoiding, and we'll talk about Tamiflu and how it can cause delirium. Guys, I guess we just talked about it then, Shannon, didn't we?
You did.
But we're going to expand upon that, and we have a focused conversation. We'll call this one Testosterone for Life, borrowing from the title of the book by Dr. Abraham Morgentaler. He's the Harvard urologist who wrote a paperback book for lay public that really reframed testosterone and demystified it for men. And we're going to discuss testosterone. We have a guest coming on, Shannon, to share his experience as well. So a great show on that level. We also are going to be explaining why men and women especially, develop that belly fat. You know what I'm talking about, Shannon? That belly fat thing? You don't need to beat up the microphone.
Wow, huh? Well, I do, of course. No one likes that. It's a terrible feeling when you never had it, and then boom, there it is. Why is it there?
And how many times have you heard, and folks, we at Intellectual Medicine have the most sophisticated and successful weight loss program, one of the most in the world.
I know.
I mean, I
would
can
say
say
the
that.
most.
We
have the results.
I've been researching this for 30 years, as many of you know. I started treating obesity in 1990, before it became it's still not on the radar. I want to say before.
It really isn't, right?
Isn't that?
It's an epidemic.
It's an epidemic.
And what are we doing?
Crickets, everybody?
Right?
No. Dead silence. Why? Look, there's an old joke in medicine. It goes like this. A patient goes to see the doctor and says, "Doc, I hope you treat what I have." And the doctor looks at the patient and says, "I hope you have what I treat." In reality, there's a human tendency to ignore problems that we have no remedy for, no knowledge of, and no approach to engage in. We just ignore it. So you will hear about, Zika virus. You'll hear about, there was a case of pertussis up in Ipswich. But you're not going to hear about obesity and our actions against it. And to the extent you hear about it, it's false comfort. You're not going to hear about lead. You'll hear about it here. We're going to talk today about the correlation between lead and brain rot, the connection between lifetime exposure and decline in your IQ. Now, I kind of like my brain, Shan, and if I had...
I know you do.
It's what I enjoy my brain. I think most people do. If you had a choice between preserving your brain against longevity, you'd want to preserve your brain.
Of course.
So we talk about Intellectual Medicine 120. I am 120. We advocate, we pursue, we have an aspiration of achieving a 120-year lifespan. It seems absurd on the face of it until we break it down and we realize, number one, people have lived to be 120, so it's not unprecedented. Number two, we know that the Half-Lick equation, studies done to look at how long cells can live, actually calculate them out to be 120 years. Number three, from a biblical sense, in Genesis, man shall live to be 120. We're coming up on Passover. I've been told it's a traditional greeting, Jewish greeting. May you live to be 120. It's a beautiful thing. Then people will say, what do they say, Shan? I don't want to be old like that, like decrepit. Well, today, folks, we're going to be highlighting why every man and woman, in our humble opinion, at some point in their life, needs to be on hormone therapy, or you will suffer the consequence. And after our break, we're going to be talking with Jim McMullen. He's a patient at Intellectual Medicine, and he'll be sharing with you his story about how he came to his knowledge and his choice to implement testosterone therapy. And we're going to be talking about the recommendations from the Endocrinology Society, orthodox medicine, and I'll share with you why I think they're wrong. Well, let's get into that piece. And here's why I think they're... Well, should we talk about Tamiflu first, though?
I think we should.
Tamiflu? Mm-hmm. Yeah. We will come back to this, people. We're going to talk about testosterone and heart disease. We're going to talk about hormone therapy and cancer in women and why These fears have been amplified and have sacrificed the well-being of patients in the process. But I got to talk about this. What's up with Tamiflu? How did this horrible drug ever become so popular? I think it's got a catchy name, doesn't it?
It does.
Tamiflu.
That was smart.
You know, hey, I have the flu. There is no known therapy for the flu. There's nothing known to absolutely cure the flu. What cures the flu? You do, folks. You do. It's your immune system. It's your capacity to fight it. Anything that improves your immunologic response does you more good than drugs. And here's the problem. In medical school, we don't learn about that, right? We don't learn about nutrition. We don't learn about vitamins. We don't learn about IV infusions. We don't learn about chelation to get rid of lead. We don't learn about hormones. We learn about drugs. And we learned about Tamiflu, and I learned about Tamiflu, and I remember, Shan, back in my unenlightened former self, I used to prescribe that drug. Yeah, I'm ashamed to admit it. So from Dr. Helen Krumholtz, he's a Yale medical professor, talked about Tamiflu and highlighted some of these facts that are worth knowing before you take that. Number one, publication bias. Now, publication bias is when a company sponsors a drug, a study, and they don't like the result. So they bury it. And this is common. The companies have control over the product. They will sponsor the study. They'll pay the docs to do it. 60% of the studies on Tamiflu have never been published. Now, do you think those studies were favorable towards Tamiflu? Yeah, logic would dictate not. Another detail, no reduction in hospitalizations in the studies published, no proof of reduced complications, no proof of decreased transmission of the flu. What in the world are we taking this drug for? Well, there is some evidence that if you take it within 24 hours of your symptom, good luck figuring that out and getting the drug. If you take it that fast, you might reduce the duration of your illness by, drumroll please, 1 day. At the price of a 25% incidence of nausea, vomiting, diarrhea, headache, you know the fine print. Oh, and here's a big one, delirium. So I had a patient reported took Tamiflu, had to pull a car over and call 911 because they were so delirious and disoriented. All that, folks, for the price of admission. And this is being commonly given. Take your, if somebody gets a flu, they give it to the whole family. Why not? Better chance of getting somebody delirious. Look, in fairness to your docs, they are time pressured and they're fed misinformation in many cases, or incomplete information, or they have no good alternative. How many times does this manifest itself? All the time. Somebody goes into the doctor, they're feeling tired, they're feeling run down, they're cold, when I was in medical school, Shan, we were taught to treat the patient, not the lab result. So what happened? We all graduated medical school and we instantly began treating the lab result. Why? It's easier. It's easier. And there's another adage. If you can't measure what's important, you give importance to what you can measure. So I'm going to check your cholesterol. Ooh, look at that. It's 272. You need a drug. You need a drug because the number says you need a drug. But doctor, I feel right. Your number says it. Or I feel tired. I've gotten weak. My brain's a little bit foggy. My sex drive has faded. I just don't feel myself. My mood is down. Could you check my testosterone level, please, doctor? I've read that these symptoms could be associated with low testosterone. The blood test shows your levels are normal. ... for an old man. Well, I don't like feeling like an old man. Can you do something about that, doc? Oh, no. The number says you're normal. Shan, the normal range for testosterone, right? How big is that variable?
God, huge.
Huge. It's huge. So when you look at normals, you look at a range, 30 to say 200, 300 is the range. Well, I don't know about you, but I want to be, I want to
be 301.
Yeah. So you go to your math teacher, gives you your test back and says, you got a D, congratulations, it's normal. That's a normal grade. Hey, Tyler, you'd be happy with a grade of a D? Yeah, but it's a normal grade. It's totally normal. Right? So that's what I feel about some of these other levels. Give me the A+ grade. So we're going to talk when we come back how to get the A+ grade, how to interpret these tests, why orthodox medicine interprets them in a manner that is tainted with bias, that deprives patients of opportunities for improvement, and really, in all fairness to orthodox medicine, the pressure on them to not engage. And when we come back, we'll be talking with James McMullen. He's an educated, erudite individual. You'll be able to listen to his story. He's 72 years young and living a vital life. And then you must stay tuned, because we are going to be talking about the evidence and the information on both sides of this equation. You know, in the world of medicine, nothing is absolute. It's all risk-benefit balance. So it's important that you develop your own philosophy. We have ours. We're advocates of hormone therapy for everybody. And we have good reason to believe that based upon our experience and research. But you have to come to your own conclusion, you know, much like James did. So stick around. This is worth listening to. And don't forget, we're going to be talking about belly fat in women. And I want to say in men, too. Men get belly fat, Shan.
They do.
We do. You know what we do? We just put our belt lower on our waist. So you say, yeah, I still got that same 32-inch waist I ever had. My belt buckle's pointing at the floor. It's like, all right, we need to fix America. Rhode Island, at least. We'll be right back. This is Dr. Steve Petteruti with Shannon on Intellectual Medicine from WPRO, your voice of Southern New England.
Southern New England weekends on
Hey, guys.
630 at 99.7
I can't make that go any lower, I know, huh? You really don't want to hear that. You want to hear us. It drives us absolutely bonkers, and we're going to be talking about this research, the limitation in the scope of intellectual curiosity regarding some of my colleagues. Look, it's not all their fault. These doctors and nurse practitioners are dedicated and focused on trying to do a good job. But here's an interesting thing I just read. They were lamenting in a journal in family medicine that family doctors are not practicing the full scope of skills that they were trained in. And I can vouch for this. It's true. I spent 4 years in medical school. I spent 3 years in my residency. Huge chunks of that time were spent on studying things that were not clinically relevant to the way I practice today. For instance, when you're in medical school, when you're a resident in family medicine, part of your training is in obstetrics and gynecology. Part of your training is in surgery. I got to tell you, folks, ain't nobody family medicine delivering babies and doing surgery unless you live in Mayberry, RFD, and you're only doctor within 200 miles. It's no longer germane. I'm being waved in. Hey, yeah, what's up?
So I don't usually call out to people too often. I'm having a little bit of trouble getting a dial tone. I will get him. It might just take me an extra minute.
Okay, keep at it. So, it's our guest, having trouble getting him on. So there you are. I'm studying all these things that I don't apply into my practice. And then the opinion was we need to find a way, this opinion which I disagree with, to help doctors then manifest all the things they've been trained. No, we don't. We need to train them differently. We need to teach them more of what we have learned on our own initiative through the many years of clinical practice that Shannon and I continue to study every day. Here's a few other problems and why your doctor is paralyzed in their current pattern of thought. 1, continuing medical education. Sounds nice, right? My doctor had 200 hours of CME. They're forcing them to study the same useless information they gave them in medical school so they can recertify with the same hollow knowledge. And that steals time they could otherwise use to studying nutrition, weight loss, hormone therapy, all the things that make life enriched that we've shared with our patients that have improved their lives. They're deprived of an opportunity to study it. And here's another problem. 30 to 40% of a doctor's time is spent administrative nuance, filling out forms, documenting on the computer. Doctors are being broken down into piece workers pushing paper. It's sad. It doesn't have to be this way. You can see an intellectual medicine doctor. You can break out of that model, but you're going to have to take that initiative, much like Jim McMullen did. I hope we can get him on air. He's a great guy. If we can't get him on air, we'll have to recapitulate his story. Jim, you could be Jim McMullen. We'll just have you. It's okay. He's on our guest. Yeah. Shannon's getting nervous. She doesn't want to mimic a male role. So we've got these barriers in medicine. And then it becomes incumbent upon patients to drive their own care. So how do you put this together? Well, you keep listening to this show. You do your own research as well. I love Dr. Abraham Morgan Taylor's book, Testosterone for Life. I actually like Suzanne Summers' work. I think that it's worth reading. Now, when I read the Suzanne Summers' work, and when I met her and spoke with her at conferences, I was impressed with the sincerity of her pursuit. I was also impressed with the fact that she's a rich woman, with a whole lot of resources that we don't have, but you don't need. I'm back, folks, Dr. Steve Petteruti. So we were just talking off air, Shannon and I, about Suzanne Summers and about Dr. Abraham Morgentaler and about some of the pioneering work that Suzanne Summers really has done. Now, she's written books, one of which is called Bombshell. And when you meet her in person, as we have, you realize she's the real deal. I mean, she looks great. And she's done her homework. And the reason intellectual medicine exists is because we have integrated lots of that information into our practice, and because we believe that it should be available to everybody. That's why we're in Warwick, Rhode Island. That's why we're in East Providence, Rhode Island, with Dr. Michael Souza. He's having something going on, isn't he, Shan?
He has an open house today. Very exciting.
Yeah, how about that? What's happening at his open house?
It is tonight from 4 to 8 at the, obviously, East Providence location
Right.
on Wampanoag Trail. He's going to have wine and hors d'oeuvres, and we're going to do some power packs for a reduction in price, and only $99.
Power Pack.
Power Pack IV.
That's one of our most popular IVs.
It is.
That
Yep.
thing is a real energy kicker for a whole lot of patients.
It sure is.
High dose vitamins, and it all, doesn't it have a glutathione push?
It does.
Yeah, glutathione, folks, for those of you who don't know about it, it's a naturally occurring antioxidant, critical to neutralizing free radicals, powerful detoxifant. You know, Shan, they can also get a wingman if they want to. Now, we're not advocating reckless alcohol consumption, ladies and gentlemen, please. We are advocating responsible use of adult beverage, and we're advocating that you neutralize some of the known toxins, and that's what the wingman does. Am I right?
It does.
Yeah.
It does.
But you can't go out and get hammered.
Well, no. I mean,
Right,
come
thank
on,
you.
we're
Well,
like
you know,
adults. But you want to have an extra glass of wine, or maybe try that new martini, and you don't want to wake up
safe.
with a headache in the
Yeah.
morning.
Well, we're back, folks. We're talking up next with Jim McMullen. Jim, good morning, Jim. Thanks for taking time and being on Intellectual Medicine with Shannon and I. Well, we were talking about Suzanne Summers, and I know you and I spoke earlier, and I thought it would be helpful, Jim, for our listeners, if you could give us a little bit of your background, some of your intellectual journey from where you were contemplating hormone and other forms of therapy to how you got to landing at intellectual medicine. Yep. Suzanne Summers on Larry King. Wow, that's going back. Yeah, well, you were on top of it. You recognized, Jim, right away that from listening to Suzanne Summers that there was substance, that this could be the new movement in medicine, but it didn't come to Rhode Island until most recently in intellectual medicine. How was your encounter with orthodox endocrinology and orthodox medicine when you brought this information to them? How'd they react to you? Right. So your test, yep. So your tests were in that broad range. Shannon and I were describing the range, folks, and the range of normal for hormones is colossal. For men, it can be anywhere from 30 to 300, depending on the lab you're using. For women, you know what the low normal is for women in testosterone, Shannon?
Isn't it 0 or like
It's
1?
0.
0.
Now, whoever thought having 0 testosterone would be good? Now, tell us a little bit, though, Jim, because you were inquiring about this. Tell us some of the symptoms that you were noting that you were contemplating may have been correlating to the hormone. Okay. Yep. Yeah. Right. So I'm going to jump in a little bit, Jim, and amplify some of what you've said. Folks, Hashimoto's is a form of low thyroid when the immune system attacks the gland. And in intellectual medicine, in the spirit of Kenny Blanchard, the functional endocrinologist, one of the pioneers, we address that in the similar manner. You have to address symptoms ahead of labs. Now, that's a topic for another day, but your symptoms included the muscle aches, the pain, fatigue, energy decrease. Now, when we met a year ago, mood, energy, sexual vitality, all these things were diminishing. And dare I say that is considered normal. And I'd say for a million years in human evolution, that's the way people normally age. At Intellectual Medicine, we advocate redefining normal as the absence of adequate hormonal support. And we're advocating that we can change the way you age. Living to be 120 is the objective. It's the aspirational objective. To get there, though, you want to bring your youth with you. Now, when you and I met, we did a body analysis. And Jim, back then, it was 31% of fat. And we did one more recently. And your percentage went down to 24%. And this is phenomenal. This is so exciting. Your muscle mass went up by 8 pounds. Now, folks, muscle mass declines as you get older. Medical terms called sarcopenia, that a waning of muscle. Now, we've all seen 80 and 90-year-olds, right? You know what they look like. You don't necessarily have to end up that way. So tell us, so we met and started some of the hormonal therapy. What have you noticed over the past year? Yeah. I love that. I love your phraseology, Jim. It's feeling your old self, feeling normal, the way you remember normal to be. Those are worthy objectives, and helping you get through the winter. That's a that seasonal depression that we all have to hack through. And here's a detail that Jim, that our listeners probably don't. One of the organs with the most testosterone receptors in it is, in fact, the brain. And when people go on hormone therapy, they typically will tell me they notice a change in their energy, their mood. They notice an improvement in their resilience to stressors. Many patients are able to come off antidepressants when their hormones are replaced and repleted. That is redefining normal. Now, we're going to talk after the break about the research regarding heart disease and testosterone and the need to go beyond testosterone to maintain youthful vitality. Were you nervous at all heading into this about what might happen? Yep. The training. Yep. Yeah. Yep. Yeah, I love it. I love it. Hey, listen, I want you to stay tuned on the radio. We'll wrap up our conversation because we're coming up on our break. And we're going to be talking about some of those fears. And Jim entered this with what I would call a healthy skepticism that he was able to overcome. And I want you folks to overcome. So when we come back, testosterone and heart disease, testosterone and prostate cancer, and that belly fat and why you should be on hormone therapy. But up next from the Revolution Soft Wash, they clean your house, folks, and your roof. Soft Wash News Center, it's Doug Lizette. Hey, Doug.
Seriously?
Good morning, Doctor. It looks like
Yeah, I know, it's really, really loud, huh? Well, thanks to Jim. What a great guy. And
So recap a little bit.
yeah, so recapping, because you guys couldn't hear all of that. Jim's a 72-year-old gentleman who enjoyed generally good health, and he saw Suzanne Summers on a Larry King interview talking about bioidentical hormone replacement and about how this replacement of your hormones, your normally, naturally occurring hormones, can reinvigorate your life, can preserve youth, preserve health, that it's something she was advocating, and it intrigued him. And as his life went by, he started to notice some symptoms manifesting: fatigue, muscle ache, weakness, loss of sexual vitality, more tendency toward depressed mood. And he started to line those up with what he was studying and learning about hormone therapy. Now, Jim's a very studious kind of individual, and he had a skepticism, what I call a healthy skepticism, going into it. But his studies convinced him that it was worth considering. He went to his endocrinologist, who he saw for his thyroid condition, and said, gee, can you test my hormone levels? And she did, and they were in the normal range. We were just talking about normal, folks. Normal is broad, right? It's 30 to 300. Well, he just made it in that low normal range and had all the symptoms of low testosterone, but not enough to instigate treatment, according to orthodox medicine. Here's the challenge that doctors face. If you do anything outside of the tight box that is universally recognized by orthodox medicine, you risk censure, negative feedback. You risk, consequence to the insurance companies. You need me? Do you need me, Tyler? You okay?
Yeah, are you keeping Jim on the line?
No, we're going to let him go. The insurance companies can come in and they can deny payment of your encounters. They can demand repayment. They can discharge you as a contracted physician because they don't like your practice. So these are the things that are affecting decision-making amongst orthodox doctors in some cases. This is the niche intellectual medicine, Phils, where we have the freedom to apply this kind of therapy to our patients. Now, in Jim's case, we started hormonal therapy. His percent body fat went from 31 to 24. If you're a man, your percent body fat should be below 25, ideally around 20. If you're a woman, it should be below 35, ideally around 30. Why? If it's above those numbers, you pick the problem, the risk goes up. Heart disease, cancer, dementia, brain atrophy. So getting the weight down, as you're going to learn in the upcoming section, we should talk about that next, Shan, that belly fat. Mm-hmm. You, in many cases, cannot achieve that goal without proper hormonal support. It's just physiologically impossible. So here's Jim, fat down, muscle mass went from 63 to 71 pounds. Incredible improvement in a gentleman of 72 years of age. Just, if not more importantly, his joie de vivre, his energy, his mood, his libido function, all back to what he remembers as being normal. Great outcomes when you focus on the patient's symptoms and you balance risks and benefits. The benefits of hormone therapy are way up here, folks, and the risks way overstated. Now, Philosophy drives the train. So you have to make these decisions. There's nothing wrong with aging in the historically old-fashioned way. You can choose to let your bones wither. You can choose to let your muscles shrink. You can choose to let your genitalia shrink, your brain fade. It's your prerogative. Just don't complain about it later, because you're hearing about it now. So it's 10 years, 20 years from now, and you're looking around the table, and all these young 80, 90-year-olds are staring back at you, and you're not the one that got on that train. Well, you heard the info.
All right.
Question?
How important is a hormone leptin?
Leptin as a hormone is still being studied. It's a hormone that is manufactured in fat cells, and we don't yet know how to clinically address that. So when fat cells are manifested, they produce leptin. It signals the brain that the fat is present. So when the brain perceives leptin in the system, it theoretically will say, good, we have enough fat, we're not going to make any more. There's a problem, however. There's something called leptin insensitivity, where the leptin levels in the blood are really high, but the brain's not perceiving it, and it keeps making fat. We don't routinely test leptin because we've not found it to be helpful in planning a clinical treatment to reduce fat. There are some drugs that will lower leptin levels. They have not been shown in humans to work in reducing fat to date. Now, it may be we need combinations to achieve that outcome. In animals, we've seen benefit. So if you're a fat rat, you want a leptin blocker, you're going to be in good shape. That's a very sophisticated question. Whoever asked that, kudos to you. You're doing your homework. And you're focusing on the hormonal, endocrinological dynamic of obesity. We know it's there. There's another hormone called ghrelin that we speak of a lot in intellectual medicine. Ghrelin is a hormone that goes from your stomach to your brain. And when your stomach doesn't have enough food in it, it'll signal to the brain, feed me. That is a hormone that has to be acknowledged in its presence, and we have to do things to help intervene. The long and the short of it is this: diet and exercise fails everybody all the time, inevitably, without support. That's a very good question. Yeah. There is no, when it comes to weight loss, there is no singular treatment that's going to work for everybody. Brain defends fat. The brain wants to be fat. The most important thing to the brain is obesity, because fat means energy, and energy means life.
Call in now at 438-WPRO or 1-800-321-WPRO.
Hey gang, we're back. It's Dr. Petteruti with Shannon. This is Intellectual Medicine, and thanks again to Jim and his conversation about hormone therapy, bioidentical hormone replacement. So he was talking about the great benefit that he had. Improved energy, muscle mass went up, fat percent went down, his vitality came back, his mood got better. Why in the world would anybody not do this? Why in the world would anybody want 80-year-old hormone levels when you can have 40-year-old hormone levels and feel that good? Well, here's the concern registered by Orthodox medicine. It's dangerous. It's going to give you cancer. You're going to get a heart attack. All right. What we know about bioidentical hormone therapy is still developing, but we've been at this now for decades, and we have not seen those dreaded consequences manifest. What we do know is that hormone therapy alone is not enough to keep your arteries open and preserve your heart and your brain. It's a piece of the puzzle. Now, for years, there was fear that testosterone would increase prostate cancer risk. In his book, Testosterone for Life, Dr. Abraham Morgentaler did a beautiful job describing why those fears are largely unfounded. It simply doesn't correlate. Men with high testosterone levels have a lower risk of prostate cancer. Likewise, there are fears looking at testosterone and heart disease. So they did a study at the Veterans Administration, and they looked at old veterans, men over 65, and what they found is if you already have heart disease, you have known heart disease, and you go on testosterone therapy, in their study, there was an uptick in heart disease consequence. That was a specific population. Subsequent study looked at men in general and found a decrease in cardiovascular complications. So, which is true? Does the testosterone increase or decrease the risk? We believe it's relatively risk neutral. The heart is a muscle. The heart likes testosterone to the extent that its pumping function can be supported. But hormone therapy will not keep your arteries open. For that, people, you must get the lead out. You've got to address chronic lead exposure. We need to talk about belly fat, don't we, Shan?
We do.
We
do.
But I got to get to the lead. The lead's so important.
It is, but fat. Come on.
Okay. Quick, and then we'll come back if we have time later. 400,000 deaths per year due to lead exposure. 400,000. Studies correlating lead have compared lead in your bone, not in the blood, lead in the bone, to brain rot, decreasing IQ, increasing risk of dementia. Now, the study was done looking at bone lead level, not necessarily blood. What we know about lead in the blood, according to a study in The Lancet, recently published, Bruce Lanphier, an expert in lead, said, quote, risk was noted down to the lowest measurable level. Shannon, what's the normal blood lead? The trick question. What's the normal level of lead in the blood? What should it be?
I would like 0.
Yes, you are correct. 0. You know what the threshold is? You know what they consider okay? They actually published. I saw a gentleman in this week, and they said if the lead is below 10, it's in the normal range. Oh my goodness, below 10? This gentleman's blood level is 9.5. That's stop the presses, get the lead out. And he was having symptoms, right? Brain fog, fatigue. Lead is a pure toxin. You should know your blood lead level. Next time you go to the doctor, get it done. And if it's 0, do not be satisfied. Go see Dr. Souza at East Bay. Come see me in Warwick. We will test the total storage of lead in your body because that is what matters. It leaches into the blood. It rots your brain, causes heart disease. Maybe it contributes to obesity. There's a correlation in toxic heavy metals and obesity. But we now know, we've known for a long time, it gets tiresome being so far ahead of the curve. We were talking about type 3 obesity. How long ago, Shan?
Oh my gosh.
Right?
Did you start that book? Yeah.
So the 3 major types of obesity. Type 1, born to be big. These are people that come out of the chute large and stay big. Type 2, midlife accumulation of adiposity. These are 20s, 20 to 30, or not midlife, but post-pubertal growth spurt. For women, it's in their 20s. For men, it comes later, late 20s, early 30s, starting to expand. Type 3, hormonally driven. The fat layer you note in the midsection of your abdomen is correlated with a loss of estrogen and testosterone in women. If you don't replace your hormones, ladies, that fat pad will not go away. You could do ab crunches until you're blue in the face. And here's diet and exercise fails everybody all the time. Nearly 100%, 99.5%. Study done by Tommy Wadden. He's a behavioralist out of University of Pennsylvania, looked at a cross-sectional study of a range of different diets. And he noted, universally, weight goes down 0 to 6 months. Great result, right? Problem. By year 3, nearly all the weight had come back. And by year 5, all the weight or more had come back in 99.5% of the people. Folks, that tells us that diet and exercise fails. Losing weight is a complex medical challenge. It requires a mixture of nutritional behavioral change, pharmacologic support, hormonal support, and the right blend of supplements to keep your health intact. That's what we do in intellectual medicine all the time. And it just works great. We've been at it for 20 years. But now we're getting more and more orthodox medicine support, and they're talking about women should be discussing this with their doctor. Here's the problem. They still maintain you should only be on estrogen for a few years to get you through the menopause, right? Just get you comfortable with the idea of withering into oblivion. Let's just give you enough hormone to get you over the choppy water. Then we'll take it away. How stupid is that? You take it away, the fat pad comes right back. People will ask me, how long should I be on my hormones for? And my answer to them is till they close the lid. There's no need to deprive yourself of its benefit. What about cancer risk? What about heart disease risk? Well, we know that oral, old-fashioned Premarin Provera, the horse urine derivatives, did have problems. They do have problems. They do increase the risk of cancer, breast cancer in some cases. They can increase the risk of heart disease. Hormones, estrogen and testosterone, should not be taken orally. They go through the liver when taken orally. They are metabolized in a manner that can cause harm. These hormones should be delivered directly. In intellectual medicine, we love doing it as implantable pellets. Magnificent, elegant, painless, and effective. We also do it in some cases with cream, transdermally, or in the case of men and women, you can do injectable testosterone. And it has to be monitored, of course. But according to Dr. Rebecca Glasser, she is a thought leader with regard to hormone therapy and testosterone in particular. She has an observational cohort study that shows a decrease in breast cancer risk in women on testosterone. So now we're putting these facts together. The risks are starting to fade based upon cumulative information. The benefits are rolling in. The fear factor diminishes the more you study it, like Jim. Healthy skepticism, followed by study, reflection, and then you make the call. How do you want to age? How do you want to live? So continue listening to us. Continue to challenge us by your own research and make your own judgment. It's harder now, Shannon. It's harder. 10, 20 years ago, you didn't have to make these decisions. Now you do. But when we come back, we do need to take another break. We're going to talk a little bit more about the adiposity and about what you could do to help prevent it. Should the sugar tax be levied on soda? And what about secondhand smoke and marijuana? Is that a risk that we should be worried about? We will be right back after this break. I'm Dr. Steve Petteruti. This is Intellectual Medicine. Yeah, right? So now marijuana is like the new safe, healthy thing. And people can just pour out billows of smoke wherever you go. Not so cool.
I know.
It's got the same risks of tobacco, maybe worse.
I know. Teens think it's not as bad.
And now they're vaping, right? There's lead in the vape. There's toxins in the smoke. What are these kids thinking? I got to put this one over here. Give me a moment, folks. I'm going to organize my cards. I did cards today. Yeah, not such a good idea. They're scattered all over the table. So I got my little talking points here. As Dr. Glass already spoke about her, do not take Tamiflu. Do not take Tamiflu if you get nothing else out of this hour together. And if you're not on hormones, look in the mirror and say, why am I not on them? Then go see Dr. Mike Susie. We have our open house. It's going to be today, 4 to 7.
4 to 8. 4 to 8.
Oh, 4 to 8. Even better. So this is a big thing, right? The socialists want to tax you to good health. They want to put tax on sugary beverages. So they create a new boogeyman, which is Coca-Cola. And they're going to put a tax on Coca-Cola because they care about your obesity. They don't care about the money they're going to get. They're only in it for your health. Nonsense. Zero evidence that taxes help weight loss. None. Well, maybe it does if you're broke, you can't buy food. They keep taxing you. Did you know there's more sugar in an ounce of orange juice than an ounce of Coca-Cola? Are we going to tax orange juice? It's Easter. Maybe we should tax Cadbury eggs. It's like, where will it end? Their concern about our health ties into their own financial well-being.
A bagel.
Yeah, that's right, a bagel.
Sugar's in a bagel.
A bagel is just like a big blob of sugar, baby, going down. And in the world of cynical, self-serving facts, the care center in Rhode Island offered to pay the state of Rhode Island $5 million. You hear about this one, Shan? They want to pay the state of Rhode Island $5 million if the state is willing to not allow other centers to open.
What's a care center?
It's the dispensaries for marijuana. And
what?
Right now, Rhode Island is considering, there are only 3 of them in Rhode Island. They have a monopoly.
Yeah, and we know who owns them.
Yeah, and now they're considering allowing 15 more to open up just to get more competition.
Good.
One of the biggest ones said, hey, look, we'll give you $5 million if you don't let anybody else come into the state. Can you imagine?
No.
Can you imagine?
No.
5 million. We care about the deficit in your budget, Rhode Island. We're going to give you 5 mil to plug that hole. How cynical.
So wrong.
It is wrong. Whatever happened to free market, right? This is what. No, think about that. How long have they been open for?
I don't even
About
know.
a year?
Yeah.
And they got 5 million. They can
already?
reach in their back pocket. Here's
Right.
5 million. It's a good thing they're not for profit center.
Oh, of course, right?
Holy cow. $5 million. How much? We should write a check to Rhode Island. I want to be the only doctor in Rhode Island. What should that check be?
Right?
What do you think? A state of Rhode Island, 5 million? Okay, here's the thing. I'll write the check for 5 million. I'll be the only doctor in Rhode Island. It's going to cost you $1,000 to come see me. Sorry.
There you go.
Sorry. Because we're only interested in quality.
Right.
And, the state of Rhode Island,
And that's the best thing to do, right?
such cynical garbage people. I got to say, I'm tired of the fight on opioid and the death from overdose. It's never going to be fixed. Too many people are profiting. You've got the whole. I'll tell you why. What are we talking about anyhow? Come back.
Lead?
What, baby?
Lead?
Lead?
We need hormones.
Hey, gang, we're back. It's Dr. Petteruti along with Shannon. Oh, my goodness. So we were talking about lead. We're talking about heart disease. So here it is from the Journal of the American Medical Association 2017. They did a review of a study looking at hormone therapy, and they concluded no increased risk in cardiovascular death or cancer mortality or all-cause mortality. None. Journal of the American Medical Association. So what is stopping us from making hormone therapy a standard? Well, I don't know. But it's not stopping us in intellectual medicine. Here's the thing, though. Simple conclusions lead to false comfort. Hormone therapy is not global anti-aging. If you're not getting chelated, if you're not doing IV therapy to remove the lead that's buried in your bones and in your cells, you're exposing yourself to unnecessary risk of heart disease and dementia. That's our judgment based upon the research that we've acquired. And we at Intellectual Medicine are the experts in chelation. I think we're the only ones doing it in Rhode Island on a routine basis is chelation. Everybody should be getting chelated. Everybody. You want to know about your health? You check your blood pressure, your cholesterol. Know your lead number. And if you have not done it, get the lead tested in your bones and in your cells through a provocative test we do at our centers. It's a urinary test.
It is. It's really inexpensive.
Yeah, how much it cost?
It's like $150
That's the whole thing.
to know all your levels.
I'm not going to get any bills later.
No.
Okay, just want to,
No other bills.
All right, that's good. $150, you know your lead. It's an important detail. If you care about your brain, you care about your heart, get on your hormones, get your lead tested. We can do this. Dr. Souza does a brilliant job of this, and we've done, hundreds, if not thousands of cases. And cadmium we see at very high levels in Rhode Island. It's a polluted world out there, and you've got to be able to protect yourself. A lot of what happens in medicine is a result of predetermined bias. So you approach something with a biased perspective. For instance, doctors know nothing about supplements. They know nothing about nutrition. The naturopaths are on the rise, Shannon. And welcome to the club, my naturopathic colleagues. I hope you continue to gain a higher prominence, as well as nurse practitioners. Welcome to the club. I welcome them as clinicians to expand this conversation. Orthodox medicine will try to crush them and delay their acceptance because they know nothing about vitamins, and yet they sit in judgment about that which they know nothing about. They will tell you, if a doctor will tell you, it's expensive urine. That's all they're manifesting ignorance. They have not bothered studying it. I know, because I used to be one of them. I used to be that guy before I took the time to dive into the research to realize that your body has an incredible ability to right itself. If somebody says to you, well, there's nothing we can do, that's the way it is. Your body, your joints are bone on bone. You've lost your muscle. Your brain is slowing down. This is your age. Nonsense. Look, if you're 99 years old and you cut your arm, it's going to heal, right? As long as you're not dead. That tells us the living organism has an enormous capacity for self-healing. This, ladies and gentlemen, is a premise of osteopathic medicine, a philosophy of medicine that is embraced by many, some of whom are osteopathic physicians, not all, and some of whom are MDs and allopathic physicians. It is not an exclusive club. Dr. Souza's in that club over at East Bay. Come see us tonight. We're going to be there. What time does that happen?
4 to 8.
And I can go there, and can I get like a dinner?
Can you get dinner? Not dinner, no. But you can have, some small bites.
Yeah, but I can eat a bunch of hors d'oeuvres and call it dinner, can't I?
You totally could.
There's no quota.
There's no quota.
I can do that. Free meal. And what else can I get there? I can get wine.
You can get wine. You can get a drip. Come on, and go with the wine.
So I can drip. I can do the whole thing. This is going to be fun. This is going to be great fun. So listen, I have a deal for the state of Rhode Island. I am willing to write a check for $5 million to the state of Rhode Island to close their budget gap if they are willing to make me the only doctor in the entire state of Rhode Island. So this is the deal that one of the care centers in Rhode Island, because they really care about Rhode Island. So here's the deal. This is, of course, I'm being facetious, folks, but this was a real offer. One of the marijuana centers in Rhode Island offered to pay the state of Rhode Island $5 million to close the budget deficit if they would simply deny other centers from opening. Can you imagine?
No, they're not really thinking about it, are they?
$5 million. I just want you to use your state power to preserve my monopoly. I'll write a check for They've only been open about 6 months.
I know.
And they got $5 million
We're
cash on hand. $5 million
Wrong
would be millions.
business.
Unbelievable. Look, folks, this is ridiculous. Now you've got, okay, so here's how you fix the opioid death crisis, right? Isn't it fascinating how contraband, once deemed illegal and dangerous, is now a major source of state revenue and therefore gets state protection? If you try to sell marijuana on your own, you're getting arrested. If you sell at a compassion center, you're leading the parade, right? Because you're being paid. Mm-hmm. Well, you're never going to stop the opioid death crisis until you make opioids legal, regulated, and you put the amount of the drug on the label. The reason these people are dying is because of unlabeled product. They don't know what they're taking. I am not advocating for the use of opioids, nor addiction. Both of these are corrosive to mental, spiritual, and physical well-being. However, it's there. And this black market industry, look, have we not learned our lesson from prohibition? Now medical marijuana is made legal. We need to tighten the reins up. Every marijuana should have a label about THC potency. Mm-hmm. And we need to get off of the secondhand smoke. Marijuana smoke in studies has been shown to be 3 times more toxic to arteries than cigarette smoke. It is toxic. You want to smoke, have a ball, do not blow it in my face, right? Everybody at Intellectual Medicine, we're advocates of freedom and free choice, even if that free choice leads to some health decrement to the individual. Now, marijuana in the right setting has some potential medicinal merit. It needs to continue to be studied, but we can't just release the hounds, right? We've got to balance it. Drives me nuts. We got to, right? We focus on the wrong thing, Shannon. That's the problem. Mm-hmm. Here we are giving Lipitor to everybody. Here we are, running around making sure everybody gets immunized.
Well, I was shocked that we were getting the faxes, right, from the pharmacy saying your
Yes.
patient should be on X. I was like, what is this?
Yeah, did you know that, people? So if you're a diabetic, or if you've ever been prescribed metformin, now we use metformin, it's a prescription drug. We use it off-label because it has been correlated with delayed cellular aging. Kind of exciting, isn't it? Yeah, so when we do that, our patients end up getting these faxes, these reports. We get them from the pharmacy saying, prescribe your patient statin drugs. They're due to be on a statin drug. Crazy. We never get reports about obesity. We never get reports about lead. These two things combined offer more harm to Rhode Islanders than, well, the entire scope of infectious disease. In all likelihood, we need better approaches. At Intellectual Medicine, we believe in your body's ability to heal itself. We believe that by virtue of doing IV infusions, you can do things that are going to support your health and well-being, make your immune system more robust, and do so without causing side effect. Drugs, yeah, sometimes they're necessary and life-saving, but they're overutilized. Tonight it is 4 to 8 o'clock. Come meet me and Shannon and Dr. Michael Souza. Until then, folks, I am Dr. Steve Petteruti, wishing you 120 youthful years. Well, folks, thanks for tuning in. And we will be back next week. And we'll be at East Providence tonight on Wampanoag Trail between 4 to 8 o'clock, enjoying a sip of wine and good company with Dr. Michael Souza. The place is beautiful. Come by and say hi, and I'll see you guys next week.